Okay, good morning everyone. I hope that you all can hear us all okay. I'm just going to introduce our presenter today. So welcome to the webinar, which is called Mentoring Training in Dissemination and Implementation Science in Cancer, a Fellow's Perspective, presented by Dr. Nicole Rankin, the T2, T3 Research Fellow at Sydney Catalyst Translational Cancer Research Centre. My name is Charlotte Quanto, and I'm the Project Officer from the Cancer Implementation Science Community of Practice, which brings this webinar to you today as part of its education programme around implementation science. So just a bit of housekeeping before we start. Nicole's going to commence the presentation shortly, and she will be welcoming your questions throughout the presentation. So to ask her your questions, please can you use the questions box which is on the GoToWebinar control panel, and write your question out and then press send to all so that the other participants should be able to see your questions as well, and Nicole will answer your questions along the way. And then after the webinar, when we close the presentation, a survey will appear on your computer. We'd very much appreciate your time if you could complete this survey, as your feedback informs and supports our future events and education programme. And if you miss completing that survey online, you should receive the link by email. So now I'm going to hand over to our presenter, Nicole. So thank you, Nicole. Over to you.
Thanks, Charlotte. Good morning, everyone. Yep, no, that's okay. We're just getting set up here. Great, thank you. Okay, so today I'm going to be talking to you about my experience being a fellow as part of MT-DIRC, which is the Mentored Training in in Dissemination and Implementation Research in Cancer. So I'll just give you a little overview when I can get to the next slide. Okay, of what we're going to talk about today. So I'm going to tell you a little bit about MT-DIRC, about the curriculum and how it was developed, give you an overview of who the faculty members are, and tell you a bit about the fellows that I attended the Summer Institute with in June this year. I'll cover a little bit about what's on offer as part of the fellowship and talk to you about my perspective in terms of what I saw the additional benefits being as being part of this process. And also then to take you through the application process as applications for the next cohort of fellows opens in a week's time, and to give you a little bit of guidance and suggestions based on my experience and also on the experiences of Maggie Pardek-Kelman, who is the program coordinator for MT-DIRC. And we were very fortunate that Maggie was here in Australia 2 weeks ago, and she was giving a presentation at the Australian Implementation Conference about how the curriculum for MT-DIRC was developed. And she came to Sydney Catalyst, TCRC here in Sydney, and was able to share her presentation with us, which was terrific, and then take some questions from local participants in that workshop. So I thought we'd just get started by asking how many people have undertaken a training course in implementation science, really just to give people that opportunity to say, yes, this is something I've done, or no, not yet, but I'd like to. I'm just going to minimise the poll so I can keep seeing my slides. And as Charlotte mentioned before, I'll take any questions that you have throughout the presentation. Great, thank you, Charlotte. And just if you're wondering, that beautiful photograph is of a resident polar bear at St. Louis Zoo, which is the most fantastic zoo I think I've been to apart from Taronga in St. Louis. It's free, and this polar bear actually has his own swimming pool, and I could have spent all day sitting there watching him. So some of the photos, or all the photos actually throughout the presentation, are from my experience in St. Louis. Okay, so down. Right.
You can share the results.
Okay, all right. And thank you for answering the poll. So we've had 22 people say yes, they've been to a formal training course in implementation science, and the majority haven't, so that's 78%. So just based on that feedback, I guess then there's definitely call for having more opportunities similar to what MT-DIRC has to offer. Okay, so what is MT-DIRC? Well, as you can see from the photo here, it's a group of people, faculty and fellows, who come together for a 2-year program of mentor training, and it's specifically in dissemination and implementation science research. The Americans tend to call the field D&I research, where we might call it knowledge translation or implementation science. There's a little bit of to and fro on how inclusive that is, but certainly for this program, it's any of the methods to understand the implementation of interventions and evidence-based practices, specifically in cancer settings. I've put on the screen there the web address for the MT-DIRC website, so you're welcome to go and have a look. It's a very easy website to navigate and find your way around. And as you can see from the photograph here, the actual course itself consists of fellows participating in 2 summer institutes. So you have 2 week-long residential courses in St. Louis, in Missouri in the US, that you attend. The first of these was originally held in 2014. So there's what they call the 2014 cohort, 2015, and so on. So as you can see here on the screen, this is the 2016 cohort, and next year will be the last cohort that's recruited, the 2017 cohort, who will participate in the workshop then for the following 2 years. Okay, so as I mentioned, 2-year training program, it's actually funded by a large NIH program grant that allows for the faculty to recruit around about 12 fellows who are funded through the program grant for each cohort. And in addition to that, the VA system, the Veterans Affairs system in the US, also funds a further 2 fellows to attend. And quite often there'll be another fellow if there can be enough money put together from other organisations to offer that 15th fellowship. So there's a very strong emphasis on mentoring. There's a whole design behind that that's involved conducting a randomised control trial of mentored training, and I'll mention one of the publications from that towards the end of the webinar. And very much a strong emphasis on having a curriculum that's driven by the fellows who are participating that year, and then learning to apply the competencies from that course, both during your residence at the Summer Institute and also in the follow-up off-site training. So the 2 summer institutes have quite a structured program of a mixture of didactic presentations and dialogue, and it's a great opportunity because you've got both formal learning with the faculty leading different sessions throughout the week, as well as informal opportunities where you can ask questions, get more information during the presentations, as well as during more, I guess, smaller group sessions that you have with your mentor and a group of up to 4 or 5 other fellows. So there's a lot of opportunities for networking and having time for one-on-one talking with some of the mentors. You are assigned 1 mentor for your whole 2-year program, and so while you meet with that person a lot, there's then obviously another 8 to 10 faculty members that you can access during the summer institutes. Off-site training involves monthly teleconferences and participation in webinars and doing regular evaluation activities, and I'll talk to you about those a little more as we go through the slides. So MT-DIRC is held at Washington University in St. Louis, or St. Louis as they say, commonly called WashU because there are so many other Washington universities in the States, so it tends to be the shorthand for what it's called. It is a privately funded university. It's one of the, I think, the top 10 most highly funded universities in the States. It has a magnificent campus that I've kind of walked around in awe looking at. And the whole of the Summer Institute is in one of their conference centres. So you're literally living and breathing the whole MT-DIRC experience for the full week, where you're on level 4 or 5, and on level 1 and 2 is where you're going for your training each day. So it is, being in that environment, a fantastic opportunity just to totally immerse yourself in the training course. And they very much encourage you not to take work from home, don't commit to doing anything else for that week, and really just try to be in the moment of taking the opportunity of focusing on the course for the whole time. So MT-DIRC is based on 2 other really successful training programs that have been run in the US in the last 6 or 7 years. The first of these is a mental health specific National Institutes of Health funded program. It tends to get called IRI, which is like MT-DIRC in that it's 2 years, it has a mentor attached and has a very similar program, but obviously their content is focused solely on mental health. And the predecessor to that program and MT-DIRC is TIDR, which is health more generally, and it's what Maggie and the other US faculty and fellows refer to as a one and done, where you go to one summer institute and then that's it, essentially finished. Both programs encourage people from Australia to apply. The one advantage with MT-DIRC over either of these other programs is that you get full funding to cover your costs. So MT-DIRC is all flights, accommodation, meals, the whole lot. So literally you as a fellow are not out of pocket for any of your costs, whereas if you're going to TIDR, you have to pay for everything. So behind all 3 training programs is very much a background in building an evidence base for mentor training. And one of the other journal articles that I'll mention at the end of the presentation that Maggie Pardek-Kelman's been the lead author on is actually a card sorting technique of how the faculty developed up the curriculum through quite a complex process, and I'm very happy to take questions on that at the end. Each year, fellows have direct input into the curriculum because you answer a number of pre-institute surveys about how confident you feel about whether you're a beginner or an intermediate learner or an expert in each of the curriculum areas. And based on the responses that all 15 fellows give to those surveys, the faculty then look at adapting the content of the presentations for the following month. So you do that in the May before you head off. So the MT-DIRC website has the list of all the curriculum content. I'm not going to go through it here because it's too detailed, but if you look at the MT-DIRC website, you'll see that the curriculum is split into 4 sections. The first being definitions, background and rationale. The second being theory and approaches. The third being design and analysis. And then section D, the final one, is on practice-based considerations. So you can look through those after the presentation. And again, if you have any questions, I'd be really happy to answer those. So a little bit more about the Summer Institute. I thought I'd just give you a brief idea of the sorts of topics that were covered in 2016 in June this year. I think the things that people probably found really helpful is that some of the leading faculty who've done systematic reviews or work in this area were actually the people presenting this work. So Rachel Tabak, who's one of the people who's done a systematic review looking at how researchers choose an implementation science model or framework, was there to present on the first topic there on the slide. There was a big focus on building partnerships and sustainability from a couple of faculty members who've had a long history of working in public health and community health sectors. There was another great session on stakeholder engagement, how to get people engaged in doing implementation research. I think one of the most beneficial sections was actually on strategies and measures and discussion about how different researchers in the field are developing up new measures that can be used by researchers to validate their research and to make it more meaningful. Some great talks on navigating the politics of innovation from different perspectives given, and from my point of view, perhaps the most novel thing was getting exposure to the people who are assessing grants in the US for dissemination and implementation research, and hearing what it is that they look for in a grant. And when they're reviewing those, what are the highlight features? So some really great hands-on knowledge on what really is going to be funded in the future in implementation research in the US. One of the faculty members gave a really nice detailed explanation of how to develop your budget and do that for grant writing. One of the really nice things about the training is that Anne Sales, who is the North American editor of Implementation Science, led a session on getting your paper published. So gave some really great tips and help. So happy again to answer any questions on that. They also each year bring in a number of guest presenters, and they change that each year. So obviously if you're a fellow returning for a second year, that you don't hear the same presentations each time. So you can see there on the screen, just giving you some examples of the sorts of topics that people covered, and in 2017 they will change and be on a different set of topics. The social networking one was really interesting. I hadn't had much exposure to that, and so was the e-health, but then all of them were really quite fascinating just to hear people's views on those. So just to give you a little bit of an overview of what's in the program in terms of meeting with your mentor and concept development, because that's a core component of the curriculum, is that you take a concept with you and you work on it with your mentor and at least 2 other fellows during the institute. You can see there from this slide that obviously on the first day you're meeting with your mentor and the other people assigned to your group, and you have an opportunity to present a concept paper which has gone in as part of your application pack. You then, over the period of that week, you actually unpack your ideas and you start to refine your study. And the nice thing is that there's such a variety of different projects that people are working on, and I'll give you some examples of those in one of the later slides. But over that process then you have the opportunity to think about the design and the approach that you're taking to your research, and the presentations and the learnings that you're getting in the didactic sessions are actually helping to inform your thinking about whether you're taking an appropriate approach to your research or whether you need to go back to the drawing board and think through a different strategy. You do get an opportunity to present your revised research plan to the fellows from the cohort who are a year ahead of you on the 4th day, and that's great because it's a nice informal way to get some critique and feedback and to refine some of your ideas again. And then on the final day you do meet up with your mentor and your 2 other co-fellows and talk about what you're going to do next. So it's an opportunity for you to set up some expectations and rules for how you're going to go over the next 2 years, because obviously with seeing everyone for a week once a year is great, but then you need to have that follow-up participation, and you do that through the monthly telephone calls. So you can see here, I've just popped up some photographs of the faculty who were there for this year. There are a range of American and Canadian experts who were there for the duration of the 5 days. My own mentor is Nicole Proctor, who's there on the left-hand side in the middle of the screen, and Nola's background is in mental health, so she's not a cancer researcher. She was one of the original grantees on the IRI training program, but it really hasn't made any difference at all that she's not cancer focused. She still brings a wealth of knowledge to the training program. John Kerner is an American but has spent many years in Canada working for the Canadian Partnership Against Cancer Control, and Maureen Dobbins, who's there in the bottom left, is also Canadian. Graham Polditz is an Australian compatriot who's been in the US, I think, for about the last 25 years. But together they have an amazingly diverse amount of knowledge about implementation and obviously research more generally. John, Graham and Ross have done a lot of work trying to ensure that implementation research opportunities are broad for international participants, and very much want to see that the capacity building isn't only happening with US researchers but also with people from countries like Canada and Australia. The nice thing also about the faculty is that they do have a diverse range of expertise in clinical research, community-based research, including primary healthcare, and policy research. So you don't go to the workshop getting a sense that it's just about cancer clinical trials or about cancer prevention or cancer screening. It's really a great breadth of information that's there. You do get to book in and have appointments with all of those faculty members throughout the session, and it's really up to you to drive that process. And you find out about people's other hidden talents. Like you'll see there from the bottom right-hand corner is just a picture of David Chambers, who likes to get up and take his guitar out and give you some entertainment partway through just to keep it interesting. As I mentioned earlier, there are about 15 fellows each year, so now we're up to about 45 fellows. That's just some of the people I've been working with this year who are on the screen in the slide. And it is a basic prerequisite that you have either a PhD or a medical doctorate as the base level training, because they really are interested in the late, well, not late, early, that doesn't make sense, but the early career and mid-career researchers who already have a really solid grounding in research, design and conduct, in addition to potentially clinical work or whatever else it is that you bring. So as I mentioned there, the community, clinical and policy backgrounds are all relevant for the fellows as well. And in the middle of the slide there you can see that the topics covered by the 2016 cohort is really quite diverse, covering obesity, tobacco control, primary care initiatives, cancer screening, and that screening is in a number of different areas, HPV vaccination, a couple of different projects in neurology, both in prostate and bladder cancer, cervical, breast, lung, and also one of the fellows is looking at patient-reported outcomes and how that's being integrated in different cancer programs. The returning fellows, as I mentioned, contribute each year so that in that second time when you go, it's not the same as your first year of experience. You actually contribute to the program and have an opportunity either to lead a session or to do some one-on-one mentoring with people during the week. So for those fellows who go along, basically there's a prerequisite that you have a willingness to participate in a number of different ways. Firstly in concept development and in taking your own concept, but also in completing evaluations. And there's quite a strong message that if you're not prepared to do those two things, then you probably are not ready to apply for MT-DIRC, because they do very much want to engage you as the fellow in thinking not only about your research project, but how you're contributing overall to this NIH program grant that's building up an evidence base for how we should be doing training in D&I research. They do also ask you to make sure that you look after yourself during the week and take time out and have some quiet time just to switch off and go for a jog, or explore St. Louis and have some time for self-reflection, which I think is a nice balanced approach. So it is very much a two-way street where fellows and mentors each have an opportunity to be totally immersed in the experience, but also that you take the time just to do what you need to look after yourself. Writing groups are something else that emerges, that people look for opportunities for how they can work on a paper together over the coming 12 months. And so there's been, I think, 3 papers that have come out of this year's cohort, and they really encourage you to do that. So one group is looking at doing a commentary paper on, I think it's around community-based healthcare, and potentially that might lead to a systematic review. Another group is looking at gynecological cancers and writing an implementation science primer or a primer on how you do implementation science in that area. And there's been also discussion about a 3rd one in primary care. So the monthly teleconferences allow you and your mentor and 2 other fellows time to meet each month, and you have a process where those times are booked in, and you send through an update of how you've been progressing your project back at home away from the Summer Institute setting. I think the calls are a great idea because it gives you the inspiration or the motivation to keep working on your concept, and to take your problems and your issues and the challenges and areas where you might need help, and to get great advice from your mentor and your co-fellows. The other nice thing is that in those monthly calls, when you call in, it's not only about your concept, but your mentor will give you a chance to talk about other things that are happening in your professional life. So if you want to talk about your career path, and one of my co-fellows is applying for a Career Development Award, he quite frequently brings questions and asks for help in how to craft an application. Those sorts of opportunities have been really useful too. So myself and the 2 other people in my group, Shelley and Florian, we see a lot of synergies in each other's work, and so we're planning as a group to think about how we could bring our 3 projects together to write up a project or a program grant, or no, it would be a project grant in the future, or maybe a publication. Even though we're working in different areas, I'm working in lung cancer, Shelley's working in prostate cancer, and Florian is working in bladder cancer. We're all looking at ways of improving outcomes for patients through quality improvement initiatives with lung cancer teams. So it's quite interesting. So obviously through those calls you get an opportunity to build your collaboration with your co-fellows and your mentor, and you have that opportunity to test your ideas in an environment which is very safe. So just to sort of give you some other impressions from my experience of being an MT-DIRC fellow, there are other additional opportunities to really get a perspective on the US opportunities for grants and how they fund their research, and it's a very enviable situation where they have quite structured programs within the National Institutes of Health program to apply for dissemination and implementation science grants. The great thing, as I mentioned earlier, is that the committee who have put those grants together have allowed those to be open to non-US citizens, although they definitely have a preference for those project proposals that show international collaboration. It would be very hard for you to apply as an Australian to get one of those grants without having US and or Canadian collaborators on those. So if you want to go away and Google those, it's called the R scheme, and you could have a look at those offline. As I mentioned throughout the presentation, there's obviously additional benefits from that exposure to new people and new ideas, and I found that one of the great opportunities was really learning where the discipline of implementation science is heading, and the sorts of things that journal editors and leaders in the field are looking for when they're reviewing publications and grants. And I think there's a great willingness for people to share different ideas in that way. So it's a very inclusive environment. You get a lot of exposure to information anecdotally that you wouldn't otherwise get being here in Australia. And I think you also get that impression that people are very connected in the US and that they have a real awareness, I guess, of what other methodologies and issues outside of cancer are current in the discipline. There are a number of e-list servers, newsletters and other resources that you also get signed up to as being part of an MT-DIRC fellow that certainly, unless you've really got your finger on the pulse, you might not be aware of that as US-based resources. Okay, so it doesn't look like we've got any questions at this point. So I'll just, to finish up with, tell you a little bit about the application process. So as I mentioned at the beginning, applications for the next round of fellows opens on the 31st of October. The outline of what it is that you need to do is already on the MT-DIRC website, but obviously it's pretty simple formula. A cover page saying who you are. You write a 2-page concept outline, and you also prepare an NIH bio sketch, which is quite similar to what you might be writing for any other kind of grant that you're applying, where you give a very succinct summary of what it is that you have done in your career and what you're working on, and a list of your previous publications and your grants. And then you also need 2 letters of recommendation. So one thing is that you need to have a local mentor who will agree to support you during the 2-year period while you're a fellow, and the second letter of recommendation comes from either your head of school or head of discipline, somebody or senior in your organisation who's saying, yes, I will support the applicant to go ahead and do this program, and give them time to go overseas for the 2 summer institutes and also to work on their project during the time. So applications close in early January, and it's definitely worth starting to put your application together early because there's a lot of competition. I think last year they had over 50 different applicants, and I was the one applicant from Australia, although there were, I think Maggie had said, about 9 or 10 other applicants. So prepare, I guess would be my message, to say get your application together early. There is an FAQ on the MT-DIRC website to answer any of your questions. And Maggie is also very helpful if you need to send questions to her. I noticed the one thing she did say when she was here 2 weeks ago was that if you can't commit to the dates for the summer institutes, please don't apply, because there's no flexibility. And if you can't attend the 2 institutes for the entire time, you wouldn't be offered a place. So that's just something to be aware of. One of the other things that quite a few people had questions about when Maggie was presenting 2 weeks ago was about the concept. Now, clearly it needs to have a dissemination and implementation focus, and it has to be in cancer, but what is included in cancer has a very broad inclusion criteria. So you would have noticed from my earlier slide that there are people doing things in obesity and prevention. So obviously cancer is a long-term strategy or outcome. It doesn't have to be specifically in cancer as such if you make cancer part of your outcome. So I hope I'm explaining that clearly enough. Okay, so I've got a question from Emily, and she's just asking the timing of the summer institutes, and you have to think about that. Okay, so it's always, Emily, the summer institutes are the first week in June. So from my recollection, I was there this week from the 5th to the 9th of June. So it's roughly the same for 2017 and 2018. Okay. So just going back to the topic of your concept doesn't have to be perfect, and it certainly is not expected that it will be funded. And one of the nice things is that if you are actually successful in applying for a fellowship, then you're allowed to make as many changes to your concept that you sent with your application before you got there. So if you, between January and May, when you're doing all your preparatory work to go to the US, want to change it, you can change your topic entirely, although I don't think they encourage you to, to dump and go with something new, but there's plenty of flexibility. So it really allows you then to develop your concept over a period of time. All fellows get an opportunity to pilot test their project that they're working on in some capacity. Some people go down the route of putting together a study protocol and putting that in for publication, and that's perfectly fine. Others want to use it for pilot funding to actually start running your project, and so all fellows receive $1,000 US for that purpose. And as you'll see there on the slide, that you can spend that on a research assistant or travel or some component of your study, but you can't use it for your own salary. So I think the take-home message about the application process is very much that the emphasis is on you as the fellow. They want to invest in you, the person who has the potential and the capacity to do dissemination and implementation research beyond the life of the fellowship. So it's not just the concept that's going to sell them, it's really your enthusiasm and your willingness to get engaged in the training program. Okay, so just to finish up, there are some useful resources that you do get as part of being a fellow. Everyone gets a copy of the recently published book that 3 of the faculty members have written. And I thought it would be a good opportunity now, just at the end of the presentation, to ask people how many are actually interested in applying to MT-DIRC for 2017, just so we can get a sense of whether there's any follow-up that you would like after the presentation today. Excuse me. Okay, great. So it looks like we've got about just over 1/3 of the people online who are interested in applying. So that's terrific, because I know they rely a lot on word of mouth from other fellows to encourage people to apply. No problem if you don't want to apply. Or if you're not eligible for applying, there might be other local opportunities that would be open to you that we could try and provide some assistance with. But that final slide there just gives you some of the present publications that have come out, and I know there's a whole range of others that the actual fellows have published. So if you have a look on the MT-DIRC website, you can see the full list and you can download all of the publications. And the bottom one there on the screen is just the card sorting technique for developing the competencies and curriculum that I mentioned earlier in the presentation. Okay, so that's the end of presentation. Most of the photos that you saw throughout the presentation I took in the St. Louis Art Gallery, which is just, they call it SLAM for short. It's a lovely place to go and relax after 5 days of intensive work. So I can highly recommend, if you're going to St. Louis, to go and spend an afternoon in the art gallery. Anyway, thank you very much for listening, and I'm really happy to take your questions.
Nicole.
You're welcome, Nick.
Just got a question.
Okay.
Thanks for the information, Nicole. Do you think it's an advantage to note if the concept has been developed into an ECR fellowship that is under review?
Sure. If you've got a concept that you've already put in for funding, they would be, I think, really keen to know that and to see that you're already looking for an opportunity to further that work. So yes, that sounds entirely appropriate and relevant. Yeah.
And from Emily, hi Nicole, Emily here again. Can we talk about the application at a later date?
Yes, very happy, Emily, to talk to you. That would be great. And similarly, for anyone else who is online, if you would like advice or suggestions, I'm really happy to share my experiences with you and to show you my application if you would find that helpful, and to tell you anything else that you might have specific questions about.
And from Kathy, is there a preference for younger applicants?
No. No, as long as you're showing that you're willing to pursue a career, or part of your career being in implementation science research. No, I don't get that sense at all. A lot of the applicants that come through are people with MDs and PhDs, so you know they're averaging maybe in their early 40s, but I don't think there's any discrimination at all on the basis of age.
Okay.
Great. Okay. All right. Thank you, everyone. I hope here's some applicants. And just a plug for our next event, which is coming up in a couple of weeks' time with ANCAST. So I'll hand back over to Charlotte.
Okay, thank you, Nicole. Thanks very much. That was a brilliant webinar, really useful to hear about that fellowship. So thank you. And as Nicole mentioned, we've just got the details of our last webinar for 2016 on the screen. So that's with ANCAST, and that'll be focusing on the policy side of our curriculum, so making a real-world impact, cracking the nut of policy with the sunbed ban. And you can see our website link at the bottom of the screen. You can go to our resources website, and you can look into the events page, and you'll find the registration link for that webinar. And on the resources tab as well, you'll be able to find the recording of this webinar and our previous webinars and workshops. So this will be posted up there in the next day or so. So thank you very much, everybody, and have a lovely day. Bye.